So I wanted to go over the syllabus with you for spring 2021 for Nursing 773. This is the Management of Acute and Complex Health Problems. This is the second of 4 courses. I like to say it's the second of 5 courses. Really, in the summertime, you're going to focus on women and children because there are definitely two unique populations. But we will certainly continue to include women and children in our readings and the things that we are doing. Your clinical objectives are to demonstrate clinical competence, your knowledge, skills related to primary care. If you have not already, please watch the video about the clinical objectives. You should individualize evidence-based practice guidelines in the management of complex episodic and chronic illnesses. So that's just honing in on your skills of assessment and plan. And so making the plan really unique to the patient. And again, that's over if you review the objectives, I think you'll see that that's covered thoroughly. And formulate comprehensive differential diagnoses and the management of increasingly complex primary care patients. Again, we want you to be seeing the patient, the first thing you see the chief complaint, and so start formulating that differential diagnosis. What questions are you going to ask when you walk in the door to narrow down your differential diagnosis and determine what the patient has? Demonstrate effective interpersonal communication to promote safety and quality of care. Safety is particularly important, as you all know. When you're in your clinical preceptors, we want you to ensure that they're coming into the room and seeing the patient. Now, you are welcome to do the history, the physical exam, and report that to your provider, the preceptor that you're working with. Make the assessment, come up with a plan for your patient and run that by them. And if they're in agreement, you can do all of those things. But for safety, they need to actually see the patient, physically see the patient. And of course, if there's telehealth, it makes it a little bit easier, but again, you don't want the patient to hang up before they've seen the provider. However, part of safety is making sure that you have a good plan, that you have a plan for follow-up if things aren't improving, et cetera. And then high quality of care, really based on evidence-based practice. And knowing that it's okay to deviate from evidence-based practice when that's not the right thing to do. Demonstrate knowledge and skill in addressing sensitive topics with patients and families. This encompasses anything from depression, anxiety, mental health disorders, to a new diagnosis of cancer, or doing a breast exam, doing a exam of the genitalia, checking the prostate, to talking about subjects like abuse and abuse, domestic violence, sexual abuse, rape, all kinds of things. So the gamut of sexual topics, or excuse me, sensitive topics. Demonstrate accountability for professional family nurse practitioner practice. Accountability is not just being accountable for showing up on time and not canceling unless you really need to, but it's also really important to be an outstanding nurse practitioner. One of the things that we want you to remember when you're going to your clinical setting is that you're a representative of PLU, you're a representative of family nurse practitioner students, and when you show up, if you're not prepared, then that's reflective of the university, that's reflective of future nurse practitioners. And so really working hard to be prepared, to know what your resources are that you want to bring with you and have available, and know where to look, when to look there. Those are really important things. Faculty information, I just want to go over the clinical faculty since we have a couple new folks. Jonathan Raffesberger, Dr. Raffesberger is going to be working with 3 of you. Professor Huntington will continue with a few of you, and then Dr. Harvey, 6 of you will be with. Please contact them promptly so that you can coordinate schedules with them to make sure that they can get your visits in. Do not hesitate. It is your job to tell us. Part of this demonstrating accountability is that if you don't feel like you're learning what you need to learn, the faculty need to know. We want you to be in a situation that you can learn and it's effective. And so please reach out to us. If you don't feel like you're getting a response, then reach out to someone else or use a different means. As you see, we have all these cell numbers here. So please use them. Your texts are not any different than they were previously, so I'm not going to go over those in detail. I do really want to point out, however, this semester that I really want you to be using the Bright Futures guidelines. They're online, you don't have to have the book, but when you're seeing children, it's very important to be using those Bright Futures guidelines. It really is a step-by-step description of what you need to be doing with your patients, particularly for well child checks. All right, and then online resources, the US Preventative Services Task Force, Bright Futures I already talked about, and the ASCVD risk estimator, which I think a number of you already have on your phones. Don't forget the STD treatment app. HealWA is a good website to get journal information, look things up. We already said that one. The drugs and lactation, you can use the app that's listed here, or Hippocrates also has drugs and lactation information. If anyone's interested, I do have a book on, what is it? Drugs and pregnancy and lactation. It's quite a large book that you're welcome to look at. It's pretty up to date still. And then so these are not readings, these are just resources that you want to have available. There are other readings, as you're aware, but they will be updated regularly in Sakai as the semester proceeds. And then under lessons and, under resources, you will find the things that we've posted in the weekly information, but also other references for yourself. As we've, Dr. Martin and I have said many times that there's so much information that you're learning, and to know that you're taking people's lives into your own hands when you're graduating is really important. So honing in on this information and really getting a good grasp of it and what to do is super important. It is expected that students are going to be spending somewhere around 2 hours a day outside of class time, outside of clinical time, reviewing this material to be really getting it down. Now, that might be listening to a podcast while you're on the treadmill or walking in the neighborhood, or, putting on a video for a few minutes when you're getting dinner ready or something. But you really want to be looking at these materials and going over them so that you're familiar with what you need to know and really grow in your profession. We really want you to graduate feeling confident in your role, which is challenging. It's really challenging to feel confident in this role. It took me a good couple years, which is normal, but we want you to graduate with the best experience that you can. And then, all right. Okay. We've already covered those Sakai weekly lesson topics. I want to go over the evaluation methods. You're familiar with Sakai, so I don't want to go over that. Professionalism will be 10% of your grade. So this is in class, that you respond, that you're prepared, that you have your coaching, you set up your coaching sessions, that you're prepared for your coaching sessions, that you ask questions when you're unsure about things, or, it's part of professionalism is, if you didn't prepare, you need to say, gosh, it was tough. Something happened that I wasn't prepared. That is okay. That's not an excuse all the time, but that it does happen, but it is part of professionalism that you acknowledge that you're not where you should be or you want to be. One of the things that is under professionalism is making clinical goals. You should be making clinical goals for your preceptors. You should share them with your clinical faculty. This is really going to be helpful. And this is like 2, 3 goals. You can make 5 or more, that's fine. But things that, you're feeling really uncomfortable with something, like you just can't get all those diabetes medications straight. So your goal is to really hone in on that and know your diabetes medications. Or maybe you're not good, you've not done a pelvic exam, and your goal is to do a pelvic exam this semester, or insert an IUD, or whatever it may be. Please remember when I say things like procedures, that you want to make sure that you are talking to your preceptor and establishing their trust. They need to trust you before they can let you do procedures and do other things. Anticipate doing a procedure with them before you do a procedure by yourself, things like that. All right, so back to this. You will have weekly SOAP notes as you did before. Your clinical faculty member will tell you, I think that everyone's gonna have them turned into Sakai. I'm not sure about Dr. Raffensperger. And then there's only going to be one comprehensive SOAP note. There's a SOAP rubric. I feel like maybe I should just go over it really briefly. So if you can be patient with me, I will stop my share and then I will share the other screen. So I have up here the brief rubric for your SOAP notes. So this is your where's the scores? There they are. Your kind of 1 through 4, that's not acceptable, needs improvement, competent, and excellent. And it really it goes through very, very succinctly everything that you need to be doing. We really want to see that when your subjective section is addressing 90 to 100% of the information that's needed for that diagnosis and supports the level of coding that you presented. And that doesn't just include your HPI, but also your family history, your past medical history, things that are important. However, we also similarly don't want extraneous data. So I don't want to know if my patient is here because she has a UTI. I don't really need to know that her hearing is okay or that her ears don't hurt, or she doesn't have a sore throat if I'm worried about a UTI, unless I'm worried about an STD, I suppose. Anyway, we want things to be complete and organized, both in your subjective and your objective. The more succinct that you can make this, the better, the easier it is to read later for everyone, including yourself when you go back and read your own notes. I have seen a variety of formats of head to toe, and I really encourage people to use one format that starts with general, and then it goes to your head, and then eyes, ears, nose, throat. Eyes sometimes are separated from that. Head, eyes, ears, nose, throat. Then it might go to cardiovascular or neck. And so neck is one. Your neck system might be lymph nodes. Your neck system could be cardiovascular or pulmonary. And you go down, continue, and to your abdomen, GU system, and then musculoskeletal, and skin, and neuro are all at the end. So think about that head to toe fashion. Excuse me for the little beeping in the background. Unanticipated and uncontrollable. All right, and then we want you to have, we want to see your differential diagnosis after we see the diagnosis, but we want to see that you have your actual diagnosis. You came up with a plan. And maybe that's pharyngitis because you didn't get the test results back before the patient left or before you wrote your note. And so you don't know if it was strep or if it was COVID or if it was something else. So you want to write your diagnosis, but then have your differential there, including your acute versus a chronic issue. Like that would be for pharyngitis, that could be a postnasal drip versus throat cancer versus, chlamydia or gonorrhea. So even for pharyngitis, there's a number of things. It could be a fungal infection. So it could be a more chronic issue as well. And then don't forget to include your red flag diagnoses that you want to remember. So I think I've got all of that information in there. And your plan of care. So this should be specific to your patient. It should take their psychosocial needs into consideration and their cultural needs into consideration. And it should be pretty thorough. You don't have to write everything you taught a patient, but you do have to say that you taught about supportive care for pharyngitis discussed. That's okay. And if you recommended medications, even if so the counter, you really need to include doses, excuse me. And always have a follow-up plan. If it's not a follow-up, next week or in 3 months or whatever it is, for diabetes or annual exam or something like that, if symptoms are not improving in 2 to 3 days, or if symptoms are worsening or whatever, whatever it is. And so then at the end, and when you're doing these soap notes, I have no problems if you guys want to put in a different color what you missed. Just make a key somewhere that, blue denotes things that you forgot to ask, but you should have asked, and you know that you should have asked them. I have no problem with that. This is time for reflection. This is what these soap notes are for. And so when you put that in, what it says to me is that you're thinking. You're thinking critically, and you should have done more than you actually did. Or you can put in the plan that you think should have happened, or you can put in the plan that your provider chose. And if you didn't agree with your provider's plan, it's okay to write your own plan in a different color and say, this is what I would have done. So the difference between this abbreviated soap note and your comprehensive soap note is really the information about your documentation. So if you're gonna, like in your differential diagnosis, maybe you're gonna put strep pharyngitis. Why did you order that lab, right? Well, the patient had, a sore throat, and they had a fever of 102, and they felt like they couldn't swallow anything. That's enough of the strep triad. I always forget the name of the thing for it. Anyway, but that's the strep triad, and that's enough to be able to say, oh yeah, this is why we ordered this. But you cite that I got this out of you're not going to get it out of this book, but you might have gotten out of your primary care book, or out of your women's health book, or whatever it be, whatever thing, or you can get it offline. Using the guidelines is terrific. But that's the difference really between these comprehensive ones and the brief ones. We don't want you to be writing a book. We really just want you to get your note in there. Okay. So avoid the extraneous data. If you're still practicing your head to toe exam, please practice it, but you don't have to document the whole thing. Okay. All right. So I'm going to close that one and open the other one. I don't think we need to save that. And then you share the other screen again. Thank you for your patience. Here's the syllabus. Okay, so that was the soap note. Weekly quizzes are the same as last time. No difference with those. They will be weekly. They will be about 10 minutes or so, and they need to be done before class. And you'll have about a day to do them. And Dr. Martin will write down those instructions for you. We talked a little bit about weekly team cases. I will provide one case, and another member of your group will provide a case from clinical. It can be from last semester, this semester. And I will email you about that in this coming week. So you want to be prepared. If you're leading the group, then you need to know everything that should be done. You should know the evidence-based guidelines. You should be able to help guide your group. What else should you ask? What other questions should you ask? What labs might you want to do? What physical exam are you going to do? What's your differential diagnosis? And you might even start with the differential diagnosis, because that really guides your history. Derm for primary care, there's significantly less of it this semester than there was last semester. There's one oral health module, then your midterm exam, similar to last semester. It'll be mostly multiple choice and short answer. You indicated to me that you really liked the case study presentations. Because we are so limited on time in the classroom, my request is that you're recording the case presentations, and I will then post them. And then I will put them on Sakai, and just make sure that everybody is watching all of the case presentations. I have not decided, but I think that with the case presentations, it would be helpful if you're making a list of maybe 5 questions to go along with your presentation, so that someone watching it can get the key information, to glean that information. So while they're listening for something. All right, and so and that is the case presentation is on something that you found interesting or challenging in the clinical setting. And I'll give some more specific guidelines about that on Sakai. There will be 3 iHuman cases. So if you have topics you would like me to put in there, you can tell me. I have not chosen them yet. I haven't decided which ones I want. And similarly, the final exam is as it was last time. We are going to have the OSCE. Bear with me again. I think it's on May 14th. I had initially told you a different date, but I talked, ooh, goodness gracious. I'm going to stop. What am I doing? Who knows? I just did something crazy. There we go. I talked with your clinical faculty, and they said that they are available in May on the 14th. Right now it is slated to be from 5 to 8 p.m. You do not have your class with Dr. Schwink that day. And so depending on the availability of your clinical faculty, we can potentially move the time up, but that date is set, that it'll occur on May 14th. Okay, and that would not be during class time, out of class time. As far as the OSCE, you can count that as your some clinical hours, but it's simulated clinical hours. They don't count as regular clinical hours, face-to-face clinical hours. As you know, there's 120 clinical hours needed this semester. We've talked about the clinical evaluation tool, and then you want to make sure your preceptor and your clinical faculty are completing that, and you're scanning it into Typhon. Put your hours into Typhon, and then you need to be turning in your signed hours by your preceptor as well. So that I look at them and I match them up with Typhon and make sure that they are the same. That should be signed weekly. All right, and then we already talked about the SOAP notes and the OSCE. With the OSCE, it's a pass or fail. However, you need to pass with an 80 or above. If something happens, the reason the OSCE is on May 14th and not May 28th is because I want you to have time that if something happens and you don't happen to pass it, that you have time to contact me and we can redo it, okay? All right. I think we've already talked about professionalism. We talked about quizzes. We talked very specifically about SOAP notes. I think we have everything under here. The course grading is the same as always, and this is kind of general information that you get for every class. So if you have any additional questions for me regarding the syllabus, please don't hesitate to email me, or you can ask in class next week. That would be just fine. And thank you very much. I hope this was helpful.